DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Hi there, folks. Welcome to DocTalk. I'm Dr. Dan Thomson, and I'm tickled to death that y'all joined us today. We're going to have a great show. Dr. Chris Blevins from the Veterinary Health Center, who's an equine veterinarian, is going to join us today and talk about equine nutrition. It's bound to be a great show. Thanks for joining us, and stay tuned.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Well, Chris, welcome to the show.
Thank you.
Folks, this is Dr. Chris Blevins, and he's an assistant professor here at Kansas State University's College of Veterinary Medicine. He's a friend and a colleague and does a great job with our field equine service that we provide out of the Veterinary Health Center here at K-State, and teach a lot of students, don't you?
Yeah, there's a few that go through.
Well, today we're going to focus on feeding the horse and equine nutrition, and I always am impressed. We have some notes here, stuff we're going to go over today, but just start out by kind of describing the equine. What's different about the horse relative to other animals?
Yeah, you know, it's one of those things where horse owners actually don't just realize it, and they try to feed it like other species, and they're a lot different than cattle, even you and I, and our dogs and cats. They're a monogastric, meaning that they have one stomach, so they're not like a cow where they have multiple stomachs or anything. But then they're also a hind gut fermenter, so they're not like a dog or cat or us, which are monogastrics, but they also can ferment different roughages based on their cecum. So their digestive system is a little bit more specialized in that aspect of being different than other species, and the way we feed them needs to be different than we feed other species, and sometimes we kind of forget about that and try to humanize the horse or do some other things with them too.
Yeah, we've humanized a lot of animals, and whenever we do that, we get ourselves in trouble.
Yeah.
So let's, and everybody knows that when you start to talk about equine nutrition, the hind gut fermenters, and then it starts at the mouth, though, the difference in the digestive systems between the different species.
Yeah.
And the teeth are very important, right?
Yeah, the teeth themselves, as you start looking at the horse, are very important because they're not going to chew it more than just one time. And so whatever they do the first time it's in their mouth is how they're going to utilize that food, whether they spit it out because they couldn't swallow it, or it comes through the other end not digested, is also a potential problem. And so their teeth are very important in getting it small enough particle size so then they can digest it. And really the amount of teeth that the horse has in its mouth is not just what's underneath the lips, which some owners kind of think of. They have all those premolars and molars that go all the way back. If you just draw a line straight down from the eye, that's how many teeth they have, column of teeth in their mouth. So the teeth are very important in digesting all those materials.
Well, and then when you start to talk about the increase in the particle size, or decrease in the particle size, the more surface area that's available, the better digestion you get. So the better chewing, better breakdown. That's really the physical digestion that's so important for those microbes to be able to attack once it gets to the hind gut.
That's exactly right, yeah, and that's why sometimes some owners will see oats and corn coming out the other end where the teeth just didn't break it down enough particle size where it even got utilized.
Yeah, well, I think that we're going to take a break. When we come back, let's talk a little bit about, getting into some of the mechanics of how you know whether your horse is in good nutrition or not, and move forward.
Sounds great.
Thanks for being here.
Thank you.
And thank you for watching us this morning. This is DocTalk. We'll be back right after the break.
This Meet the Veterinarian is brought to you by Merck Animal Health, the science of healthier animals. Dr. Brian Hudapal has been with the Veterinary Medical Clinic in Williamsburg, Iowa since 2001. He works primarily with cow-calf and feedlot operations and enjoys working with ultrasound, embryo transfer, and has been in charge of the heifer development program for the past 10 years. He and his wife have 3 children, and he enjoys spending time with his family as well as golfing and hunting.
You know, I think people are just kind of born with a passion.
I wouldn't be where I am today without that horse.
Oh, I'm not passionate about horses. That's just something that's in here. I can't explain it.
Some people go to a job every day. I just go do what I love to do. That's all I know is horse.
The bottom line, we're for the horse. It's whatever we can do to make life better for the horse, wherever they are, whatever they do.
They're just magic, that's all. They got me.
If we always do what's right for the horse, we will never go wrong.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey there, folks. Welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Chris Blevins, who is an associate professor here at Kansas State University's Veterinary Health Center and is in charge of our equine field service. Yep. And so you're seeing a lot of horses, you're working with a lot of owners, you're teaching a lot of students. Let's get right into managing that horse's nutrition. And so what's the first thing that we're going to look at on an individual basis?
You know, the simplest concept to remember about horse and nutrition is what condition is your horse? What body condition, how much flesh, how much bones can you see versus muscle? And being able to body condition score your horse is very important. And when we look at the scale of a horse, it's usually 1 being very thin or 9 being very obese. So 1 through 9 is the condition score that we give to a horse. So ideally, we'd like a horse to be around a 5 to 6 out of 9. Maybe just so you can see some of the ribs, or maybe you can't see the ribs, but you can palpate them based on a 6 body condition score.
So it isn't any different than any other animal. I mean, dogs, cats, cattle, horses all have a body condition score. Yep. We try to get them within that frame. So when we start to, let's say a horse is too thin, or let's say a horse is too fleshy. Generally, when it's too thin, you probably want to go into establishing those requirements for that horse based on its use, right?
Yes, yeah, and so, maintenance themselves for a horse, even if a horse is too thin, or even maybe based on what work that they're doing, you have to establish what the horse is used for and how many calories that horse is actually burning. And you have to know, even seasonally, they're going to burn different just for maintenance. So that's just maintenance, how they can survive just based on what they're doing at a day-to-day basis. And then horses are a little different where they get used. They get used for different work, whether it's competitions or going for a weekend show or maybe just hopping on and riding it, light work. type stuff, maybe just once a week, or the grandkids get on the horse. So it all kind of depends on how much energy they're going to be burning based on maintenance or even based on work, and then you can kind of decipher through what you should be feeding it based on then.
So let's go into the base nutrition. The base nutrition, of course, is going to be that roughage.
Yep. Yeah, and so with roughage, and that would include any hay material or grazing out in a pasture, because again, they're herbivores, so they should by nature be grazing on something. And that is also something that owners probably don't really realize is by nature, a horse should be grazing 16 to 18 hours of a 24-hour period. And so a lot of times what we do as humans is we feed them once or twice a day, and so are we allowing them to graze for that 24-hour or 16 to 18-hour period of time? Probably not. Should we? Yes. And so that is something that just on base that we should be doing.
So it's a full-time job.
It's a full-time, yeah. They're herbivores and eating all the time. Yeah.
So we're going to have to go to the break, but what about water?
Yeah, water, they should be drinking water and have access to water all the time. You start limiting that water, colic or even potential other aspects of dehydration could be a part of concern.
Cool. Well, let's take a break. Folks, thanks for watching the show today. This is Dr. Chris Blevins here at Kansas State University. We're talking about equine nutrition, and when we come back, we're going to talk about how to feed your horse. Thanks for watching us, and we'll see you here right after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hey folks, welcome to today's On the Farm tip, and today we're going to talk about how to identify sick cattle through the DART method: depression, anorexia, respiratory, and temperature. A depressed calf is one that has its head down, it's singled itself out from the group, it's got a dry nose, dull eyes, and its ears are down, and it's not paying attention to its surroundings. Anorexia means the animal's off feed. These animals will have a hollow gut, have that hollow look over their flank, and they're off feed. Sick animals don't eat, and animals that don't eat get sick. Respiratory rate. If we have acidosis or respiratory disease, these animals will increase their respiratory rates and they will breathe irregularly. And lastly, is the animal exhibiting a high rectal temperature. Normal rectal temp for a feedlot calf is 1015 to 1035 Fahrenheit. If these things add up, DART, depression, anorexia, respiratory, and temperature, then you have an animal that's probably not doing right. We need to get it in, check it out, and give it a treatment. That's today's On the Farm tip.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Baytril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytril 100, right the first time.
Hi there, I'm Dr. Dan Thompson. Be sure to join me at the 47th Annual AABP Convention, September 18th through the 20th. I encourage anybody that's involved in the beef or dairy veterinary profession to attend. Reconnect with other professionals and learn about the practical applications in the beef and dairy industries. There will be scientific sessions, clinical forums, and over 100 animal health exhibitors. If you're a practitioner, a technician, or a vet student, join me at AABP. I'm Dr. Dan Thompson, and I'll see you in Albuquerque.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Blevins, who's assistant professor and in charge of our equine field service here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. And we're talking about feeding the horse. And we've gone through digestive tract, we've gone through some of the different things as far as roughage and how long the animal should graze. Now let's get into developing that program and what are some of the things, you know, how much do I feed, how much do they eat, how do I judge that?
Yeah, I mean, the best thing to indicate that is going to be based on percentage of body weight. So knowing how much your horse weighs and then going from there. Usually a horse should digest or eat 2 to 3% of their body weight in a day, and that's in dry matter. And so when you look at that, and as for an example, maybe a 1,100-pound horse just for maintenance, which is a normal size quarter horse, should be eating around 25 to 28 pounds of hay. So that's not even dry matter, that's everything included with it. So that could give you an idea how much they should consume of just roughage in a day.
Absolutely. So they're going to eat that much roughage, but how do I make that decision? I go back to the body condition score and the use of the animal. How do I go back into what do I supplement and what are some of the things I need to worry about supplementing?
Yeah, you know, when you're looking at that, and always we make a base based on roughage. So you feed your roughage, and then depending on the body condition score, you adapt what you should do based on that, whether kind of limiting the amount of roughage if they're obese versus adding extra. And the supplements could be calories based on grains. And you know, there's a lot of pelleted feeds and grains and sweet feeds. There's also a lot of oils that you could add to the food to add extra calories. But then there's also these supplements of vitamins, minerals, joint supplements that can be added to, and a lot of owners will add also to the diet. But it's also going to be dependent on, is it in the roughage? Do they need it? And so those things are going to be dependent on whether they need or not.
Okay. Well, so any vitamins, minerals that are special, salt?
Yes. Salt is very important for the horse because one aspect is they sweat it out. And because horses sweat so much, they need to replenish the salt. So all times having access to salt. It helps with water consumption, helps with eating, so making sure they have salt is also very important.
You bet. So we talked a little bit about the 2 to 3% body weight and roughage. So on a 1,100-pound horse, 25 to 28 pounds.
Right.
So then how much, what are we looking at for the grain supplement?
Yeah, usually that's going to be about 1% of the body weight. And so when you start looking at that, you know, it could be anywhere from 3 to 6 pounds of grain a day if they need it. So this is when we start adding it if they need it. And that's the problem with most owners is they think that their horse needs grain, but a lot of times they're herbivores. They'll be fine on roughage.
Yeah, and too much grain will equal
potentially laminitis, obesity. There's all kinds of different things. Growth issues with foals, if they're fed too much too fast, is also some potential indications of we feed too much grain.
Well, I think this is some great stuff. 2 to 3% body weight for roughage, 1% for the grains. Make sure you got salt supplemented all the time and fresh water out there.
Yep, that's right.
Well, when we come back, let's do a little wrap up.
All right, sounds great.
Hey, thanks for watching DocTalk. We're going to take a break and we're going to see you in a minute.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hey there, folks. Welcome to today's Beef Quality Assurance Tip of the Day. And whenever you go through a beef quality assurance assessment, whether you use the tool for feedlots, stocker, or cow-calf operations, some of the things that go into feed accessibility, water accessibility, and cattle comfort are going to be checking the water tanks, which we should have clean, ample, fresh supply of water available. We have great management of our water tanks and great management of our feed bunks, and we make sure that the animals have fresh, ample feed supplied in bunks that they can reach and water supply that's available with enough space. Cattle comfort comes in the pen. If we have mud in the pen, we need to get that box blade out or our loader out and start to clear a spot where those animals have a comfortable place to lay down. Water tanks, feed bunks, and cattle comfort in the pen all part of Beef Quality Assurance Tip of the Day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. I'm here with Dr. Chris Blevins, who's an assistant professor and in charge of our equine field service for the Veterinary Health Center at the vet school at Kansas State University. And Chris, we've been talking, had a great discussion today about feeding the horse, and I've learned a lot, and I'm sure that our guests have too. But let's go into some of the different options. There's so many different ways to feed a horse and different products out there, but just different hays, different concentrates, complete feeds.
Yeah, and it's kind of, you can get lost at a feed store or a co-op just looking at horse feeds. And I mean, there's so many different options. What should we be doing? And that kind of loss gets back to, just like we were talking about earlier, just go back to the basics and roughage and those things. But gosh, there's all kinds of things that you can feed. You can feed a dehydrated hay cube that you add water to. There's alfalfa cubes. There's alfalfa pellets. There's different type of concentrates, pelleted, sweet feeds. There's different complete feeds, and which are different. They look a lot like a concentrate, but you can feed a lot more of them. And so especially like equine senior type feeds, they're more a complete feed, which you need to feed more of than just a concentrate. So that's also different. You know, there's also different types of hays that you can feed your horse, and whether the hay is chopped up in bags, there's all kinds of things and options for that too. And so when you're starting to look at those things and different options and different supplements, yeah, an owner can get really lost in those kind of situations.
So let's say I go in there and I am lost. I mean, you know, work with your veterinarian, work with your co-op. I mean, who do I get a hold of?
Yeah, I think start with your veterinarian, a good reliable source. And maybe if they are not comfortable discussing nutrition, they'll find you a good equine nutritionist. And with equine nutrition, always think about your universities. They'll usually have an equine nutritionist. In addition to different feed companies, will also have equine nutritionists that you can go off of. Even talk to your extension agents. Maybe they can help too, but your veterinarian can definitely be a good source.
Yeah, because I think that a lot of times, you know, you're sitting there and you see all these different programs and products and different things, and you're like, geez, you know, which one of these should I be using? And so I need that unbiased somebody that's in it for me,
right,
to discuss about what I should be feeding my horse.
Right, yeah, because you'll get all keltered and it'll be some big fad, but it's just a fad and maybe not necessarily needed in some situations. So you just have to take it and kind of go and use a professional.
But I think you're spot on when you say that. Any closing?
Well, I think the biggest thing is making sure we don't overfeed our horse. The obese horse, that's a big topic, and tough love is what I usually, whenever I start going with those for owners, and they don't necessarily need grain, especially if they're obese, and taking that grain away, exercise them, and kind of limiting the aspect and using your veterinarian.
Cool. Well, folks, we really appreciate you watching Doc Talk today. It's been a great show. Chris, thanks for joining us.
Thank you.
I learned a lot, and I always do whenever you're on the show.
Well, thank you very much.
And folks, if you want to know more about what Dr. Blevins and I do, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local veterinarian. Thanks for watching Doc Talk this morning. I'm Dr. Dan Thomson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.